Hello, I'm Dr. Kumara, and I specialize in the care of teens and young adults with PCOS, also known as polycystic ovarian syndrome. PCOS is a common problem in girls and young women. In fact, 1 in 10 adult women have PCOS, and while the data for pediatrics is limited, some studies say that 3 to 9% of young adolescents have PCOS. PCOS is a hormone imbalance that can lead to irregular periods, excess hair on the face, chest, lower stomach, and lower back, and can also cause acne. Some women with PCOS can also have an increased risk of developing type 2 diabetes or can have a harder time losing weight. PCOS can also begin in the teen years and last into adulthood. The exact cause of PCOS is not clear. Many women with PCOS have insulin resistance. This means their body can't use insulin well. As a result, insulin levels build up in the body and may cause higher androgen levels. Obesity can also increase insulin levels and make PCOS symptoms worse. PCOS may also run in families. It is common for sisters or a mother and a daughter to have PCOS. PCOS is caused by an imbalance in hormones or chemical messengers in your brain and your ovaries. PCOS usually happens when a hormone called luteinizing hormone from the pituitary gland or levels of insulin from the pancreas are too high, which then cause the ovaries to make extra amounts of testosterone. PCOS is strongly linked with obesity, and as obesity levels have risen, PCOS has become more common as a diagnosis. However, there are also lean women who suffer from PCOS, and almost all women with PCOS have some degree of insulin resistance, which is known as prediabetes. Treatments recommended for PCOS are multifactorial. The goal is really to manage your symptoms of PCOS. We want to correct your hormone imbalance and lower your testosterone levels. We want to regulate your periods and lower your risk of endometrial cancer and prevent unplanned pregnancy, especially if you're sexually active. And we also want to try to decrease painful or heavy periods if that's an issue for you. For irregular periods, we discuss hormone treatments such as birth control pills with or without estrogen. We also use birth control pills to make your periods more predictable. For decreasing your diabetes risk, we focus on lifestyle modification with a lower carbohydrate diet, adequate lean protein, and increased veggies. We can also try medications such as metformin to lower your insulin levels. For increased acne, we talk about treatment for the acne, and we can try medications for this, both topical and oral. We also talk about electrolysis and laser hair removal. As you can see, we really try to focus on your symptom management for PCOS. In addition, there are supplements that you can take, but they have mixed reviews. As a result, we are still exploring if those are helpful for younger patients. While there's no cure for PCOS, we can help you manage your symptoms. Some studies do show that if women lose 10% of their body weight, they can reverse some of the signs of PCOS. Even a modest amount of weight loss can begin to reverse some of the symptoms of PCOS. For example, if you are 50 pounds overweight, losing 10 pounds can make a big difference in your PCOS diagnosis and symptoms. Even though you might significantly be overweight, even that amount of weight loss can help. Above all, you want to lose weight at a pace that you can maintain long term. We want your testosterone levels to be lower, periods to be more regular and predictable, and we want to prevent or treat diabetes. Young women also find acne and hair growth to be annoying, so we work together to find helpful treatment for these issues as well. If you or someone you care about suffers from PCOS, this is my area of expertise and I'm here to help. You can learn more about me and my clinic by visiting themaraclinic.com.